Hello class, my name is Pierre-Louis. I'm going to go over my PowerPoint, which is on substance use disorder, class MN668, PMHNP diagnosis and management across the lifespan, number 3, Dr. Jennifer Sam. I'm going to flip my camera to the screen so I can show you my PowerPoint. Let me see. I guess. Okay, I'll just go over my PowerPoint. This is the introduction. The selected topic for discussion on a substance use disorder is opioids. These substances act on receptors to produce morphine-like effects. Although some people misuse the drugs, it is intended for easing pain like anesthesia. The epidemiology of opioids. Opioid use and misuse include opioid addiction, have become a global public health crisis. The epidemiology of opioids is complex, and multiple factors contribute to the development of opioid use disorders. Social, economic, and health-related factors have contributed to its prevalence. In the United States, opioid-related overdose deaths were approximately 47,600 in 2017, said by Wilson et al. 2020. As I go, my reference page will be at the end. For risk factors, the most critical risk factor for developing an opioid use disorder is previous exposure to opioids. Other risk factors include a history of substance abuse, mental health disorders, and social factors such as poverty and homelessness. Also, factors like certain populations, such as veterans, people living in rural areas, and Native Americans are prone to the latter, saying Greg and Al 2019. Most common and uncommon subjective and objective findings. Subjective findings in people with opioid use disorders may include cravings for opioids, difficulty controlling drug use, and continued use despite negative consequences. Objective findings may include changes in appearance, weight loss, and constipation. Differentials and the diagnostic workup. Differential diagnoses for opioid use disorder include other substance use disorders, psychiatric disorders, and medical conditions. The diagnostic workup for opioid use disorders includes a history and physical examination, laboratory tests, and imaging studies. Say with Jones and McCain-Katz 2019. Potential abnormal finding of opioid case. Potential abnormal findings in people with opioid use disorders include Like I mentioned before, changes in appearance, weight loss, and constipation. Besides, the following abnormalities are realized: respiratory depression, increased heart rate, nausea, itching, and rash. Now we're going to move on to a plan of care for addressing opioid cases. The treatment of opioid use disorder typically includes a combination of pharmacologic and non-pharmacologic interventions. The Centers for Disease Control and Prevention, CDC, have identified measures for addressing the opioid crisis, including increasing access to medication-assisted treatment, enhancing access to naloxone, and expanding public surveillance. Wilson et al. 2020. As the plan of care for addressing opioid cases continued, medications to treat opioid use disorders include methadone, buprenorphine, and naltrexone. Non-pharmacologic interventions include individual and group counseling, 12-step programs, and family therapy. Education, health promotions, and referrals to social services are also essential components of care. Jones and McMahon's Carls, 2019. Like I said, the reference page is at the end. Now I'm reaching out to the last page, which is the reference page. I don't think I'll need to go over it, but you guys can see it in the PowerPoint. That's all. Thank you.